Dirk, the director and founder of the Brisbane Headache and Migraine Clinic. Today we'll be discussing about headache versus migraines and how to tell them apart. So have you ever wondered whether you suffer from headaches or is it a migraine? Now migraine affects approximately 15% or about 1 billion people in the world and is regarded as being more serious than headaches alone. Its severity has often caused sufferers to lose their jobs and even marital breakdowns because of the effects. And we see this happen many times at our clinic. Now, if you suffer from if you suffer from migraines, you may experience some or all of the following features, and this includes pain being on one side of the head. Usually migraines affects just one side of the head, however it can switch from side to side. Now, you may also experience nausea and vomiting. Other symptoms which migraines exhibit with is sensitive to light, which is photophobia, or sound, which is phonophobia, or even smell. Visual disturbances such as aura symptoms can occur, which is patients experience with either spots, either dark or white spots, or even lines, colourful lines going through their eye in the visual field, or even a tunnel vision. The worst thing that aura can happen is when the black spot in the visual field becomes so big to the point where they become temporarily blind. You may also experience speech disturbances or even swallowing issues as well when you have a migraine. Now, on the other hand, headache, also known as tension type headache, affects approximately 20.8% or 1.4 billion people in the world, and it is regarded as the most common form of headache that one can exhibit with. Although it is not as severe as migraine, it does have some disastrous issues. So if you suffer from headaches, you may experience some of the following features, and this includes pain being on both sides of the head quite equally, and it may feel like as if the temples are being a lot of pressure within the temple, like a screwdriver drilling into the sides of the temple, or patients often refer as having a very tight helmet, and the helmet is getting squeezed tighter and tighter throughout the head. Now, pain is often felt like a constant pressure or tightening of the head, and headache sufferers may experience sensitivity to light, sound, or smell, which is similar to migraine. Now, pain is not as severe as migraine, however, it can last up to 7 days. Now, too often are headache sufferers diagnosed incorrectly, which sufferers are then given the wrong form of treatment. So specific types of headache conditions require different treatment in order to effectively stop them for good. Whether you suffer from headaches or migraines, or menstrual migraines, cluster headaches, sinus headaches, cervicogenic headaches, vertigo headaches, you name it, there's a whole list of different types of headaches. Ensure you get your headaches diagnosed correctly to ensure you get the correct treatment. If you haven't had your headaches diagnosed and still live with a life filled with headaches and migraines, then we strongly recommend that you have your headaches assessed by an expert clinician, which is a headache practitioner. Thank you, and I look forward to viewing you all in the next video. Have a great and pleasant evening.